Right now, take off one sock. Look at the skin where the elastic sat all day. If there's a clear groove pressed into your calf, one that takes 30 seconds, a minute, sometimes longer to smooth back out, keep watching. Because what you're looking at usually isn't a sock problem, and despite what a lot of people over 60 get told, it usually isn't a heart problem either. Most of the time, it's a drainage problem, and the system responsible is one almost nobody ever explains to you. There may already be half a liter, even a full liter of fluid sitting quietly in the tissue around your ankle and calf right now. Tonight, when you lie down, that fluid is going to move in a way that can disturb your sleep. Let's look at exactly what's happening, why it's so often misdiagnosed, and the habit that helps drain it before bed. I'm David Morgan. You know this moment. Shoes come off, and the ankles look thicker than they did this morning. You press a thumb above the ankle bone, and it leaves a little dent that takes a while to fill back in. At a checkup, this usually gets treated as a heart or salt issue. Cut sodium, take a water pill. For some people, that helps a little. For a lot of people over 60, it barely moves the needle. And by the end of this video, you'll understand exactly why. Your body actually runs two separate fluid networks, and most people have only ever heard of one. The first is blood. Arteries carrying it out, veins carrying it back. With a dedicated pump, your heart, running every second automatically, whether you help it or not. The second network is the lymphatic system. And here's the part almost nobody explains. It has no pump. None. As blood moves through your smallest vessels, some fluid naturally seeps out into the surrounding tissue to bathe your cells. That's normal and constant. That fluid, along with cellular waste and excess protein, is collected by a separate set of vessels, lymph capillaries, and carried through lymph nodes, which filter it and play a real role in immune function before finally returning to your bloodstream near the base of your neck. Roughly 2 liters of this fluid move through that system every single day. But unlike your blood vessels, lymph vessels have no muscular pump of their own. They rely entirely on outside pressure, your muscles contracting around them. Every step, every calf contraction, every ankle flex squeezes those vessels and pushes fluid upward, one small stretch of tubing at a time. Stop moving for a few hours, and that entire relay slows to a crawl. At 30, this barely matters. The vessels are elastic. The one-way valves inside them close crisply, and a short walk restarts the whole system within minutes. After 60, 3 things shift at once. The lymph vessel walls stiffen as their elastin content naturally declines with age. The one-way valves inside them become less efficient at snapping shut, allowing some backward leakage. And the loose connective tissue around your ankle, which normally helps contain fluid, loses some of its own elasticity too. None of that means your lymphatic system is failing. It means the math shifts slightly. Fluid seeps into the tissue a little faster than the system, running without a pump, can move it back out. Over years, that small daily imbalance is what builds the reservoir you see by evening. Here's why that reservoir specifically wrecks your sleep. The moment you lie down, gravity stops pulling fluid into your ankles, and all that accumulated fluid starts moving back into circulation instead. Your kidneys detect the extra volume and respond the only way they know how, by producing more urine, often in the middle of the night. That's the actual mechanism behind waking up once, twice, sometimes 3 times a night to use the bathroom, a pattern a lot of people quietly accept as just part of getting older. Often, it's simply your evening's fluid reservoir being processed at the least convenient possible time. Before we go further, an important pause. Some ankle swelling is not a lymph issue at all. It's a genuine medical emergency. If any of the following describe you, stop and contact a doctor today, not this routine. One leg swells suddenly and dramatically more than the other within a matter of hours, and it's painful, warm, or noticeably red. That specific pattern can indicate a blood clot in a deep vein, and it needs same-day medical attention. This is not something to monitor at home. Both legs swell, and you're also short of breath, especially when lying flat. or you wake up gasping for air, or a flight of stairs leaves you unusually winded. That combination points toward the heart needing proper evaluation, not a home routine. Swelling shows up alongside sudden weight gain, 4 or 5 pounds in a single week, along with foamy or bubbly urine. That combination suggests the kidneys may be letting protein escape into the urine, and it deserves blood work this week, not next month. And swelling that's one-sided, painless, and firm to the touch, especially with a personal history of cancer treatment in that region, can indicate a lymph node blockage that needs its own dedicated evaluation. If none of these describe you, if your swelling is gradual, symmetrical, worse by evening and noticeably better by morning, with no breathing trouble at rest, what comes next is for you. There are essentially 3 patterns of chronic evening ankle swelling after 60. They can look fairly similar to the eye, but they have very different underlying causes, and treating the wrong one rarely helps. Pattern 1 is venous. The one-way valves inside your leg veins have weakened, so blood doesn't return to the heart as efficiently. It pools, pressure rises in the vein, and fluid gets pushed out through the vessel wall into surrounding tissue. This one is often paired with visible varicose veins or a brownish discoloration near the ankle, and it gets noticeably worse after long periods of standing. Pattern 2, lymphatic, is what we're focused on today. Lymph flow has slowed and the tissue is saturated. The swelling tends to be soft, leaves a slow-filling dent when pressed, and often involves the top of the foot specifically, the part right behind your toes. In a way, venous swelling usually doesn't. Pattern 3 is cardiac or kidney-related. The swelling is symmetric, tends to worsen steadily through the day, and critically, it's paired with other symptoms. Shortness of breath, needing to urinate multiple times overnight, unusual fatigue, or rapid weight gain. That combination needs a full medical workup, not a self-care routine. Please don't try to manage that pattern with what follows in this video. There's a 4th contributor that gets overlooked constantly, and it's worth pausing on specifically. Certain common medications cause ankle swelling as a direct, well-documented side effect, completely separate from your heart or kidneys. The biggest one is a class of blood pressure medication called calcium channel blockers. Amlodipine is the most commonly prescribed example, along with felodipine and nifedipine. These work by relaxing your small arteries more than your veins. That imbalance raises pressure specifically inside the tiny capillaries in your lower legs, pushing fluid out into the tissue. It's not fluid overload, and it's not your kidneys retaining salt, which is exactly why a water pill often does very little for this specific cause. The fluid was never in your bloodstream to begin with. This swelling can appear within the first few weeks of starting the medication, or even after years on a stable dose, and it's dose-related. Higher doses cause it more often. Certain anti-inflammatory painkillers, the kind used regularly for joint pain, and some diabetes medications carry a similar, well-documented tendency to cause fluid retention in the legs. If you've been taking an over-the-counter anti-inflammatory daily for weeks or months for arthritis or back pain, that's genuinely worth mentioning too. It's one of the most common, unrecognized contributors to ankle swelling in adults over 60. None of this means stop taking your medication. Please don't do that on your own. It means this is genuinely worth a specific conversation at your next appointment. Is any medication I'm currently taking a plausible contributor to this swelling? And are there alternatives with a lower tendency to cause it? 2 quick checks you can do right now, 30 seconds total. Test 1, the pit test. Find the bony ridge on the front of your shin about 4 inches above the ankle and press your thumb in firmly for about 15 seconds. Lift your thumb and look. A dent that takes 10 seconds or more to smooth out is what's clinically called pitting edema. Note roughly how deep it is and how long it lingers. You'll recheck this same spot in 2 weeks, and the change tends to be genuinely noticeable. Test 2, the foot skin pinch. Try to gently pinch the skin on top of your foot, just behind your second toe, between thumb and forefinger. If you can lift it into a small fold, your lymphatic flow is reasonably active. If the skin feels fused to the tissue beneath and won't lift at all, That's a recognized clinical sign, sometimes called a positive stemmer sign, and it points toward a more advanced degree of lymphatic congestion, worth mentioning to your doctor. 3 everyday habits quietly make lymphatic swelling worse, and most people over 60 do all 3 most days without realizing it. First, hidden sodium, not the salt shaker. The sodium tucked into cheese, cured meats, canned soup, bread, and restaurant meals. Sodium genuinely draws water out of your bloodstream and into surrounding tissue, and most people underestimate how much of it they're actually consuming once you count what's hidden in processed and restaurant food, rather than what's added at the table. Second, sitting still for hours right after your evening meal, which happens to be exactly when your legs are already pulling in the most fluid from a day of gravity and inactivity. Third, alcohol. Even a single evening drink can widen capillaries, increase how much fluid leaks into surrounding tissue, and disrupt the hormonal signal your body normally uses to slow fluid retention overnight. One drink, and ankles are often noticeably worse by morning. Now the other direction, what actually supports lymph flow. Water, counterintuitively, drinking less doesn't help. Dehydration makes lymph fluid thicker and more sluggish, harder for a pumpless system to move at all. Aim for steady hydration spread through the day, tapering off in the couple of hours before bed, so you're not fighting your own bladder on top of everything else. A well-hydrated body genuinely moves lymph more easily than a dehydrated one. Flavonoid-rich foods, dark berries, buckwheat, citrus peel, and red cabbage are associated with supporting the strength of small blood vessel walls, potentially reducing how much fluid leaks out in the first place. Protein matters here too, and this one surprises people. Low blood albumin, a protein whose job is partly to keep water inside your blood vessels rather than let it leak into tissue, is a genuine and under-recognized contributor to swelling in older adults who often eat less protein than they need. 2 servings a day of a quality protein source, eggs, fish, chicken, lentils, cottage cheese, supports that balance. And magnesium, commonly low in adults over 60, supports the smooth muscle tone in vessel walls. Pumpkin seeds, leafy greens, and almonds are simple, everyday sources. One more habit that costs nothing. If you have a long stretch of sitting planned, a car ride, a movie, an afternoon at a desk, try to prop your feet up on a stool or ottoman for even 10 minutes partway through. Small elevation breaks during the day genuinely add up alongside the evening routine. They're not a replacement for it. One more tool worth mentioning honestly: graduated compression stockings. For genuine venous or lymphatic swelling, properly fitted compression socks, snugger at the ankle, looser higher up, apply outside pressure that helps push fluid upward the way your calf muscles normally would. They're genuinely evidence-based, not a gimmick, but fit matters enormously. A poorly fitted stocking can make things worse. If daily swelling is significant, it's worth asking your doctor or pharmacist about being properly measured for a pair rather than guessing at a size online. Now, the daily habit itself, the part that matters most. And I'll explain why each piece works as we go, so it's not just a list to follow blindly. Morning. Before your feet touch the floor. 30 slow ankle pumps pointing your toes down, then flexing them back up toward your face. About 45 seconds. After 8 hours lying flat, your lymph system had a chance to mostly clear yesterday's reservoir. This restarts circulation before gravity gets a head start on a fresh day. During the day, roughly every hour you're sitting, 20 calf pumps, heels down, pumping your toes up and down, or rising onto the balls of your feet a few times if you're able to stand. About 30 seconds. This is the muscle pump mechanism in action. It keeps the conveyor belt moving instead of letting fluid quietly accumulate for hours. Before dinner, 5 minutes of easy walking around the block, the house, or the yard. Nothing intense, just movement. Walking engages the deep calf muscles more directly than seated exercises can, and doing it before your biggest meal, rather than after, gets ahead of the hours of stillness that typically follow dinner. 90 minutes before bed, the most important part of the whole routine. Lie down with your legs resting up against a wall, heels above your hips, hips above your heart. Stay there for 15 minutes. Gravity is now working with you instead of against you. During that time, do slow ankle circles, 10 in each direction, then alternating ankle flexes, about 20. Small movements while inverted give the muscle pump extra help draining what gravity alone won't finish. For the last few minutes, rest both hands on your abdomen and breathe slowly and deeply through your nose, letting your belly rise. Deep breathing genuinely engages the thoracic duct, the main drainage vessel of your entire lymphatic system, which sits just behind your diaphragm. Every deep breath is, quite literally, helping pump that fluid along. Afterward, roll to your side and sit up slowly. Then, using the flat of your fingers, gently stroke the skin from your ankle toward your knee. Slow, light pressure. Always upward, never down. About 10 strokes on each leg. This is a simplified version of manual lymphatic drainage, a real technique used in physical therapy, and it physically nudges fluid out of the tissue and into the lymph capillaries that carry it back towards circulation. You may notice you need to urinate fairly soon after finishing this sequence. That's a good sign. It's the fluid your kidneys are now processing while you're awake and aware, instead of waking you at 2 in the morning to do the exact same job. A realistic timeline, and I want to be honest rather than dramatic here. Some people notice their sock marks fading within the first week or two of doing this consistently. For others, especially if swelling has built up gradually over years, it takes longer. This is a management habit meant to reduce a daily burden, not an overnight fix. And it's meant to sit alongside your doctor's care and any medication review, not replace either one. If your swelling doesn't meaningfully improve after a few consistent weeks, that itself is useful information to bring back to your doctor. It also tells your doctor something specific, that the swelling likely isn't purely a movement or lifestyle issue, which can help point the next conversation toward medication review, vein studies, or a referral to a lymphedema specialist if one is genuinely needed. 5 things to try starting tonight. 1. Do the pit test right now and write down what you find. You'll want that baseline. 2. Identify your single biggest hidden sodium source. Cheese, cured meat, or canned soup are common culprits, and swap it out for 2 weeks. 3. Take a 5-minute walk before dinner tonight, not after. 4. 90 minutes before bed. Legs up the wall for 15 minutes with slow belly breathing, followed by gentle upward strokes on each calf. 5. Tomorrow morning, 30 ankle pumps before your feet hit the floor. And 6. At your next appointment, ask directly whether any current medication could be contributing, particularly if you take a blood pressure medication in the calcium channel blocker family. If someone you love has ankles that swell by evening, there's a real chance they've been told it's their heart or their salt intake without anyone ever explaining the drainage system underneath it, or asking about their medication list. This video may be the explanation nobody gave them. Your ankles aren't betraying you. They're a drainage system that stopped getting the daily signals it needs to keep up, and a 5-minute routine can genuinely help it catch back up. This video was written and researched with AI assistance, reviewed for accuracy against the medical sources it references. It's general educational information, not personal medical advice. Please don't use it in place of an actual diagnosis, especially if any of the warning signs mentioned earlier apply to you. If this was useful, subscribing genuinely helps this channel keep going, and I read the comments. They shape what gets covered next.